13 people have died as a result of COVID-19 in the past 24 hours. The Ministry of Health says the persons were 9 men and 4 women. 2 of the persons had no pre-existing health conditions. The deaths take the COVID-related death toll to 1,785. The Ministry of Health is also reporting 354 new positive cases of COVID-19. The number of cases reported were from samples taken between November 4th and November 7th. The total number of cases now stands at 5,685.
In addition to protecting oneself from the COVID-19 virus, vaccinations can also reduce the risk of transmission. This is according to epidemiologist Dr. AVERY, who said the number of COVID-19 cases continue to climb because of the increased transmissibility of the Delta variant, which is now present among the population.
And the only real remedy for that is to help to decouple those increasing numbers from increasing hospitalizations and increasing deaths by having increasing levels of vaccination for your own protection. Each individual who is vaccinated has a greatly reduced risk of having serious illness and death.
While it is each person's choice to get vaccinated, Dr. Hinds said it is the only way to boost immunity against the COVID-19 virus.
We know that the overall public health recommendation is that as many people be vaccinated as possible, and the extent to which we have largely vaccinated populations is the extent to which we will reduce the risk of transmission of illness in any population.
Dr. Hinds said the vaccination regimen must be done in addition to following public health regulations.
And the 3% of vaccinated people who died from the COVID-19 virus were immunocompromised. But epidemiologist Dr. AVERY said it may be difficult to ascertain which vaccines were administered to the patients. Kimberly D'Souza tells us more.
It may be difficult to determine which vaccines were administered among the 3% of patients who died from COVID-19 following vaccination. According to epidemiologist Dr. AVERY, one predominant brand of the COVID-19 vaccine was administered to the vast majority of the population.
So it's not really, I think, useful to look at which brand we are seeing the numbers in, because you're going to be affected by the fact that the majority of the vaccines we've been given actually belong to one particular brand.
Dr. Hinds said many of the patients had comorbidities and were also immunocompromised.
In the individuals who did have a full vaccination regimen on board and then proceeded to succumb to the COVID-19 virus, one of the main factors that we saw, one of the recurring factors, was the fact that many of these people had quite severe comorbidities alongside their COVID-19 infection.
Details about the fatalities are also difficult to determine since the time frame following their death and vaccination varies.
The time frames after which we're seeing these effects vary from very soon after the 2-week period, because we use that as the cutoff, to a couple months after, 1 or 2 months post the vaccination.
The Ministry of Health will continue to gather information about the fatalities. Kimberly D'Souza, TTT News.